Hello, and welcome to the Bryan Bariatric Advantage information session. This video will answer common questions about weight loss surgery and the process leading up to surgery. Our program includes surgeons, a dietitian, and nurse practitioners. Together, we will prepare and support you through this process to help you achieve your goals. My name is Tara, and I am the nurse practitioner who will guide you as you prepare for your surgery and in your follow-up care. During this video, you'll also hear from our surgeons about how weight loss surgery works and the different types of surgeries, as well as our dietitian and a mental health professional about their roles to help you on your weight loss journey. Obesity is a chronic disease that can take a significant toll on your health. There are several serious medical conditions linked to obesity, such as high blood pressure, type 2 diabetes, sleep apnea, and joint pain. Obesity can also affect a person's ability to perform regular daily activities. There are many factors that influence obesity. One of the factors is the environment. This includes our Western diet that is high in processed, prepackaged foods, fried foods, and sugar. We have become a society of convenience and are more sedentary in our jobs and our daily lives. Medications and genetics are also a contributing factor to obesity. To be considered a candidate for surgery, we use a measurement called BMI, or body mass index. This is the ratio of weight to height. Insurance companies that cover weight loss surgery use this in the consideration to qualify for surgery. Bariatric surgery may be a treatment option for patients with a BMI greater than 40. Patients with a BMI greater than 35 can be considered if they have conditions such as high blood pressure, sleep apnea, or diabetes. These are conditions that have shown improvement after weight loss surgery. Patients should have a history of attempting to lose weight without achieving or maintaining beneficial weight loss.
Bryan Bariatric Advantage is part of the Bryan Medical Center. We are the only hospital in Lincoln accredited as a Center of Excellence for Bariatric Surgery through the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. The value of having surgery at a Center of Excellence is knowing that you are being taken care of at a facility that has gone through a rigorous review process. Accreditation requires that we maintain the resources and uphold the standards of practice for bariatric surgery. We have also been designated with Blue Cross Blue Shield Blues Distinction Plus and as a United Healthcare Center of Excellence. These are very distinguished designations only awarded to programs with a proven history of delivering exceptional care and results. To understand how weight loss surgery works, it is helpful to know about the normal digestive process. After food is chewed and swallowed, it moves down the esophagus to the stomach. This is where digestive juices start breaking down the food we've eaten. The food then travels through the stomach to the small intestine, where bile and other digestive enzymes continue to break down food. In the small intestine, nutrients from food are absorbed. At Bryan, bariatric surgery is done laparoscopically whenever possible. The benefits of laparoscopic surgery include faster recovery time, less pain, and lower risk of hernias and infections. This procedure can be done with traditional laparoscopic surgery or with a state-of-the-art robot that replicates the surgeon's hand movements.
Gastric sleeve is the most popular bariatric surgery due to its potential for significant weight loss and low risk of complications. With this surgery, we remove about 80% of the stomach so that it looks like a long tube or sleeve. The reduced stomach size helps you feel full faster, and this decreases your appetite. The small intestine remains intact to absorb the nutrients your body needs. Advantages of gastric sleeve surgery include potential for significant weight loss, similar to gastric bypass surgery, no rerouting of the intestinal tract, which can cause short and long-term problems, Nutrients and vitamins continue to be absorbed by your body, and secretion of the hunger hormone is reduced, making you feel less hungry. Disadvantages of gastric sleeve surgery include the risk of a leak, which is when the gastric contents leak out of the stomach and into the abdominal cavity. There's also the possibility of increased acid reflux, and the procedure is not reversible. As with any surgery, there are risks. These can include side effects of anesthesia, and if people aren't active enough after surgery, blood clots in the legs and lungs. The most common side effects are nausea and vomiting, dehydration, gas and bloating, temporary hair thinning or loss, constipation, and depression.
With lap band surgery, an inflatable band is placed at the top of the stomach to create a small pouch. This decrease in the size of the stomach allows you to feel fuller faster. The band is filled with saline to make it larger or smaller as needed for each patient. The advantages of lap band surgery include: it's less invasive, the body continues to absorb the nutrients it needs, so there's no vitamin, mineral, or protein deficiencies due to malabsorption. There's no rerouting of the intestinal tract, and the band can be removed at any time. The disadvantages of lap band surgery include slower and less weight loss than other bariatric surgeries. A foreign object, the lap band, is placed in the body. There's a risk of the band moving or breaking down, which may result in needing a second surgery. A risk of mechanical failure of the band, the possibility of saline leaking from the band, and the need for routine follow-up for band adjustment. Gastric bypass surgery reroutes food past most of the stomach and part of the small intestine. A new small stomach is created. This limits the amount of food a person can eat. The small bowel is divided, and one end is attached to the new stomach pouch. The other end of the small intestine, which is still connected to the non-functional end of the stomach, is then reconnected farther down the intestinal tract, allowing digestive enzymes to mix with food, creating less absorption of calories and nutrients. The advantages of gastric bypass surgery include faster initial weight loss, a potential for significant weight loss, improved control of diabetes, and in some cases, reduces or even eliminates the need for diabetic medications. The disadvantages of gastric bypass surgery include the risk of developing ulcers, hernias, and bowel obstructions, malnutrition, vitamin deficiencies, and sometimes anemia. Also, the size of the gastric pouch can increase, causing weight regain.
It is important to understand that bariatric surgery is a tool for weight loss. It's not a fix for obesity. Maintaining weight loss takes commitment and personal responsibility. Long-term success depends mostly on a person's motivation, knowledge, and lifestyle behaviors. We will help you prepare for surgery in a way that focuses on reaching your long-term goals and meeting your insurance requirements. We start with a one-on-one consultation with a surgeon or a nurse practitioner. We will discuss your medical history and make sure that surgery is safe and appropriate for you. We will also visit about other evaluations and medical clearances that you may need. These can include, but are not limited to, a psychological evaluation, exercise consultation, and a pulmonary clearance. Insurance may require 3, 6, or up to 12 months of medical weight management. At these appointments, you will learn what types of diet and lifestyle changes will help you achieve the best results after surgery. We will monitor your ongoing medical conditions and work with other members of your healthcare team to coordinate your care.
Our team at Bryan Counseling Center will help you prepare mentally and emotionally for your surgery. Everyone has some level of stress if they are having surgery. With weight loss surgery, this can go beyond the procedure because of the many changes you will be making in your life before and after surgery. This includes diet, exercise, and lifestyle habits. Through a series of 2 to 3 visits, we will evaluate your readiness for surgery. During these visits, we will discuss your health and life history, ways you manage daily stress, and your support system. We will also look at your coping skills for the upcoming changes in your life and direct you towards developing the skills you need to succeed.
My role here as a dietitian is to prepare my patients for surgery by educating you on the basics of nutrition and the behavior and diet changes necessary to succeed. After an initial nutrition assessment, we will meet monthly to talk about key items important to your success. We will identify where you struggle with food, develop a plan, and monitor your progress. Depending on your surgery, you will have a specific diet plan to follow. You'll go through what we call a diet progression. This allows your stomach to heal after surgery and also can help avoid issues such as nausea or vomiting. As your diet progresses, we recommend a lower carb diet with an emphasis on getting an adequate amount of protein. After surgery, I meet with patients routinely to ensure their long-term success.
Follow-up after surgery will help with your weight loss success and your overall health. It's important to us that we continue to work with you after surgery. We even offer a monthly support group and a monthly newsletter. At Bryan Bariatric Advantage, our surgeons, nurse practitioners, and dietitians are here to support you. This, along with your lifelong commitment to healthy eating, lifestyle changes, and regular physical activity, are the keys to your long-term weight loss. When you choose Bryan Bariatric Advantage, you become part of our family. We're here to help you achieve your goals. From your first appointment to years after surgery, we're excited to guide and assist you through this transformation.